And the Biden administration says it will go to court to sort out two competing rulings regarding an abortion medication. It's called, I always say this wrong, so I'm not going to say it. We'll get into it deeply in the next segment.
And a federal judge in Texas essentially threw out the FDA's approval of the drug, which came in the year 2000. Meanwhile, another federal judge in Washington state issued a counter ruling ordering the FDA to make no changes in 17 states that are currently suing for even wider access to this medication.
Those are the top stories, and that last one we're going to continue getting into right now with Jessica Levinson and Dr. Celine Gounder. Jessica is a CBS News legal contributor, and Dr. Gounder is the editor-at-large for public health at Kaiser Health News. She's also an infectious disease specialist and epidemiologist at NYU and a CBS News medical contributor. Jessica, I want to go to you first. When the Supreme Court knocked down Roe v. Wade, it said it was returning the question of abortion access to the people's representatives. Now we have a judge, not the people's representatives, saying that the abortion drug should not be available, and another saying, actually, no, the FDA is right in making it available. Conflicting rulings. So bottom line it for me right now, if you could, are people still able to legally access this drug right now in its limbo state, and will people be able to access it for the foreseeable future?
Yes, and I don't know. So you're exactly right to point out that in that Dobbs decision in late June of this year, the court said, you know what, this isn't our lane. Let's leave it to elected representatives. And then, of course, here we are talking about two federal judge rulings that in practical ways conflict. And they certainly are pointing in exactly the opposite direction. To your question, at this point, the Texas judge's ruling, that's the one that suspended approval of the FDA's approval of mifepristone. That is stayed for at least 7 days, and I expect it will be stayed, meaning paused, longer. And therefore, people who need and want access to mifepristone in the very short term can obtain it. I think that stay will probably be put in place by the Fifth Circuit. That's the Court of Appeals that will hear this decision, and then potentially by the Supreme Court, because what we're talking about in terms of the stay is just keeping the status quo while this case is litigated. And legally, that makes all the sense in the world. And so I think at least in the short and then medium-ish term, there will still be access to mifepristone.
And Dr. Gounder, I mean, this, for decades, mifepristone has been prescribed. It's been deemed safe by the FDA. Talk to us about just how commonly it is used and what kind of impact would this have on people seeking an abortion in states where it might become unavailable. What options do they have?
Medication abortion now makes up more than half of all abortions in the United States. Women like it because it's much more convenient. They can often do it in the privacy of their own home. So it just feels safer and more comfortable for a lot of people. In terms of the impact, well, if this ruling stands, if the FDA is forced to remove mifepristone, withdraw its approval for mifepristone, you do have some very real health risks. People forget that carrying a pregnancy in the United States is more dangerous than any other high-income developed country in the world. To give you some numbers on that, the risk of death from mifepristone, 5 in a million. The risk of death from a forced pregnancy that you don't want to carry, 330 per million. So that's 70 times more deadly to carry that unwanted pregnancy than to take mifepristone.
So, Dr. Gounder, if this drug is taken off the market, then doctors will have to make will find alternatives, I suppose, for that half of abortions. How concerned are they about being able to solve that conundrum?
You still have misoprostol, which is approved not just for medication abortions, but for a number of other uses. So you could use misoprostol alone for a medication abortion. In fact, that's done in much of the world. It is less, it is more uncomfortable. It is less effective, but it could still be done. And then you also have the option of ordering medication abortion pills, in fact, from overseas. There's a group called Aid Access. It's aidaccess.org, where even now already you can order medication abortion pills from overseas.
And Jessica, just legally speaking, I mean, one of the comments over the weekend from the White House was saying that, you know, if a judge can do this in a Texas district, that no medication is safe. Can you, talk to us about, first of all, what does that mean? If you can contextualize, does this mean that a court can just decide that a medication is not safe or should be withdrawn? And also, of course, can this case get to the Supreme Court? If it does, can we expect that this conservative court will just rule against access to the medication?
Great question. So, and I'll take the last one first, which is I do think this has to be destined for the Supreme Court, in part because we have these competing rulings. But I will say, just because this is a conservative ruling and a conservative court, I don't necessarily think that that means that this Texas judge's opinion is upheld. There is basically an escape hatch here that the Supreme Court can use where they'll say, you know what, the people who sued in Texas, the doctors and the medical associations, they don't have something called standing to walk into the courthouse doors and to sue. Now, in terms of your first question, basically, does this mean that it's open season now on any drugs that are approved by the FDA? I will say if we look at the rationale behind at least the first part of the decision broadly, yes, it means that you can challenge the FDA approval of a pill, let's remember 23 years ago, that has a lot of safety data behind it. And if you find a favorable judge, you might at least be able to see a temporary injunction. That, of course, would hugely upheave our understanding of the FDA approval process and all of those who rely on it.
Wow. And, raises questions about just birth control in general. Jessica Levinson, Dr. Celine Gounder, thank you for bringing your legal and medical expertise to the table.